Hi everyone, it's Marika from Hemisphere, and I'd like to talk today about manual therapy for pelvic girdle pain in pregnancy. And when I talk about pelvic girdle pain, what I'm talking about is pain around the front of the pelvis, so around that symphysis pubis and sometimes going into that inner thigh, or around the back of the pelvis, which is often around the buttocks and those sacroiliac joints. So women will often come in and they'll say, "Oh, my pelvis is out. I've got sharp pain in my buttock. My pelvis is all loose and keeps going out of place." These are some of the common expressions that women will use when they come in for pelvic girdle pain. And typically it's those things like walking, standing on one leg, rolling over in bed, putting on underwear and shoes and socks and things like that that are problematic. And I guess one of the questions that we have to ask when it comes to manual therapy is, what is it we're actually doing? Like, what are we trying to do when we put our hands on women who have pelvic girdle pain? So are we actually changing the position of the joints? Are we pushing things back into place? Are we loosening things that are stiff? Are we making a change at a muscular level by causing some kind of relaxation of the muscles around the pelvis? Are we creating a placebo effect? Are we just causing some kind of change to the nervous system? And I think when it comes to manual therapy in pregnancy, we've probably got a lot more questions than we have answers in regards to this. So what are we actually achieving? We're not really sure. But I'm going to talk a little bit about the pros and cons of manual therapy for these conditions. And one of the pros is, well, the obvious one is that a lot of women actually feel better for it. So I definitely use manual therapy in my clinic with women with pelvic girdle pain. I won't tell them I'm pushing things back into place, but I will certainly put my hands on women and do some manual therapy, whether that's some joint mobilizations or massage in and around the pelvis. And they will often say that they feel better for it. One of the other advantages, of course, is it's not invasive. We don't have to pull out acupuncture needles or give women injections or give them medication. So it's something that is non-invasive and it's very simple to do. So it doesn't often have to be particularly complicated in terms of the techniques that we use. What are the cons involved? I guess the main one is that it involves someone else. So you can't do it for yourself. You can obviously use things like foam rollers or spiky balls. You might have a partner at home who's good at massage. But if we're talking about manual therapy from a physiotherapist or a chiropractor or an osteopath, it means getting in your car, driving somewhere and having someone do something to you. So it's reliant on someone else to perform that particular technique, which may mean that it becomes expensive over time, especially if you're coming back from multiple sessions. And some women will come to rely on those sessions. They might, and it might reinforce some of those negative beliefs around pelvic girdle pain. So for some women, there is that sense of feeling like things are out of joint and that they need someone to come and put it back into place. Whereas what we often want to do is, or prefer to do, is to try and help women develop their own management strategies, so know that they can help relieve pain for themselves, whether that's through exercise or different positioning. But we don't really want to reinforce negative beliefs around the pelvic girdle, so beliefs that it's unstable, that she is fragile, that she can't do anything for herself. We really don't want to be reinforcing those beliefs, but trying to establish some kind of more positive image of her body at that point in time. But what does the research tell us around manual therapy? In terms of palpation, so I guess a lot of manual therapy relies on feeling what is happening at the joints. If we say that we're changing joints and putting things back and changing their positions, the research is pretty clear that we're actually not very good at palpating joint position and joint movement. So there have been pretty good studies that have showed that testing the pelvis and seeing what's happening is actually not very reliable. But we are pretty good at assessing whether or not the pelvic joints are a source of pain. So we have some good tests that we can do that actually show that the pelvis is a source of pain. So we're pretty good at that, but we're not very good at testing whether or not things are moving too much or not enough. In terms of using manual therapy as an actual treatment modality, again, you'd be unsurprised to hear that it's pretty inconclusive. And there are some systematic reviews that are being done at the moment looking at all sorts of different treatments around the pelvis. I know that the Cochrane collaboration is looking at that at the moment, but the systematic reviews thus far have been pretty inconclusive in terms of using manual therapy as a treatment modality. So I think in summary, it can be a great tool. We probably don't want to encourage reliance on manual therapy for women who are pregnant. We do want to change the mindset around pelvic girdle pain, that it is not pelvis is popping in and out of joint, and this sort of fragility of looseness around the pelvis, and the fact that we want our women to feel robust and strong and in control of their pain, and give them some strategies to deal with pelvic girdle pain for the remainder of their pregnancy and beyond. Do you have any thoughts about manual therapy and pelvic girdle pain? Do you use it in your practice? What are your thoughts? I'd love to hear them. Pop them down in the discussion below.